Laws and Ethics NCCT prep. Um, we are going to be doing, it's a slideshow, but it's going to be interactive for us. I had a student tell me that she went to YouTube and watched my Laws and Ethics um, presentation from before. Anybody's welcome to do that. I do want to, however, say that they've updated NCCT prep a little bit. They use, and of course, there are different tests too. So we're going to hit a little bit of everything, even though, you know, this practice may only have a short amount of, for example, Truth in Lending Act, but your test may have a bunch. So my goal is to give you a general understanding of each thing so that no matter how many questions and what questions you have, you're going to be able to know the answers. So I'm going to share my screen. I don't think that's what I want to share with you. That's my Chinese show that I listen to in the background. Okay, let me start again. Okay, why is it not? Bear with me, technical difficulties. Miss Brandy is probably not surprised. It's been a long time since I've done this. All right, let's try one more time. There she is. So, laws and ethics. Okay, the first thing that we're going to talk about is the Truth in Lending Act. So, you might see it listed as TILA, TILA, but that is what it is, Truth in Lending Act. The Truth in Lending Act is a federal law that requires healthcare providers and all creditors to clearly explain the terms of any payment plan, credit agreement offered to patients. This means that patient must be told upfront and in writing about things like total cost, interest, finance charges, and payment schedule before they agree. So let's talk about just beyond medical billing and coding. So if you go to buy a car, what if you haven't bought a car? Let's think if you go to buy a home, if you can imagine going and buying any major thing, they're going to show you in writing what the total cost is, what your interest rates are going to be, what your finance charges are going to be, and what your payment is going to be, and what the amount of the payment is going to be. That's being truthful in the amount of money they're lending you and every charge that goes along with that. In medical billing, if a clinic or an office allows a patient to pay their balance over time through an installment plan with more than 4 payments or with interest, Truth in Lending Act rules apply and a written disclosure must be provided. All right, so now we're going to do a question. Which of the following which of the following requires lenders to discuss credit terms and for the creditor to use uniform methods for computing the cost of credit? So we're talking about lenders. We're talking about credit terms, which means they're going to run your credit score, and the cost of the credit, the interest rate, finance charges, and how much your payment's going to be. Does everybody have an answer in? Quenisha, do you want to put your answer? Oh, sorry. I wasn't trying to rush you. Absolutely right. The answer is B. Do you guys understand what the Truth in Lending Act is? Anytime that you get lent money, there are finance charges or interest rates, and they have to tell you how much it's going to be and when it's due. If they don't, that's not following Truth in Lending. That's being shady. So I wanted to put this in here because it's going to tell you about some of the other acts. And so I want you to make note of this. So the Truth in Lending Act requires lenders to discuss credit terms and for the creditor to use uniform methods for computing the costs of credit. Let's talk about the Equal Credit Opportunity Act. It prohibits discrimination in credit. That means no matter age, race, background, you are allowed by law to apply for credit. That doesn't mean you're going to get it, but you're allowed to apply for it. And then we're going to talk about the Fair Crediting Reporting Act, Credit Reporting Act. It protects the consumer information collected by reporting agencies. Fair Credit Billing and Credit Act regulates billing practices for open-ended credit. So like for me, I can't say, ooh, I want to go check Miss Brandy's credit. No, it's all protected information. It has to go through the proper channels. Okay, next we're going to talk about Emergency Medical Treatment and Labor Act. Now, this is something new that they just added. Welcome, Shannon. So let's talk about what it is. Emergency medical screening examinations, including active labor, are covered by the Emergency Medical Treatment and Labor Act. The other options, oh, don't pay any attention to that. I use the rationale. So let's just look at this. And I want you to look at a word here, emergency. So which act covers emergency medical screening examinations and active labor? A says Family Medical Leave Act. B says Affordable Care Act. C says Emergency Medical Treatment and Labor. And D says Patient Safety and Quality Improvement Act. So can you guys tell me why you picked C? Oh, I made you worried, right? You're all right. But you chose C because of the word what? Emergency. Emergency act, which act covers emergency medical screening? Well, duh, Emergency Medical Treatment and Labor Act. So you used a key word here to find your answer. Does that make sense? Thumbs up if it makes sense. Come on, Annie, because it states emergency and labor. Thank you, Angelique. Very, very well done. You can come off mute and talk, guys. I didn't mean that you couldn't do that, but I just didn't want everybody hollering out the answers at one time because then I can't tell where they're coming from. So that was the reason. I don't expect you to stay on mute the whole time. If I ask a question, please feel free to come off mute. I should have explained that better. Okay, so the next thing I want to talk about is scope of practice. Have any of you guys ever heard or learned about scope of practice? Well, we're going to learn about it today, so here we go. Scope of practice refers to the specific duties, responsibilities, and tasks that a healthcare professional is legally allowed to perform based on their education, training, certification, and state regulations. It defines what they are qualified and permitted to do in their role to ensure safe and appropriate patient care. So I'm going to throw out a scenario. Okay, so you're a front office medical assistant. What you do is you take insurance card, you schedule patients, you send out notifications. Dr. Jones comes in and says, hey, medical office assistant, I need you to come take Mrs. Barry's blood pressure. As a front office medical assistant, you have the right to say what?
No, sir, I cannot do that.
No. Okay. Can you guys tell me why you would say no?
Because you're not trained to do that.
Okay. Very good, Angelique. But let me ask you, if you've been you were a medical assistant, which assists the doctor in the back of the clinic. You help with patients, you take temperatures, you do the weight and all of those things, but you decided that you wanted the front desk job. And the doctor asks you to go and take blood pressure. What would you say? Now, keeping in mind that you've worked in the back of the clinic and you've done all of those things before, but you just wanted a desk job. You could actually, go ahead.
I don't think I can leave my position.
The doctor's asking you, there's a backup person, they're shorthanded in the clinic, and it's okay for you to go. Then you could actually go and take the blood pressure for one reason. You were trained to do so when you worked in the back of the clinic. Now, right now, like for me, say that I go and work in a front office and the doctor comes in and says, hey, Miss Marcia, can you come take a blood pressure? I can equivocally say, absolutely not. I'm not trained on that. I don't feel comfortable, and that's out of my scope of practice. Does that make sense?
Yes.
Okay, there we go. All right, so here's our question. Why is it important for people in every area of the healthcare facility to stay within their scope of practice? A, to analyze the effect each employee has on care. B, to limit employee growth and opportunities. C, to decrease positive feedback in reviews. And D, to protect the patient from harm. Got a couple of D's. Quanisha says A or D. Okay. Shannon, do you want to weigh in? Okay. Quanisha, let's read A. To analyze the effect each employee has on care. Now, I get why you would think maybe that would be the would be the answer. But if I was asked to go administer a shot to a patient, I could cause that patient harm because it's not in my scope of practice. So the doctor's not going to analyze me for taking care of patients in the clinic because I'm a medical billing and coding specialist. So the answer is D. He don't want to analyze anything. He don't want to say, okay, you go do this and I'm going to see how it works. He'd be in a lot of trouble. Patients would not be happy because I don't know how to do blood pressure. Now, could I give a shot? Absolutely could give a shot because I have a diabetic son, but that's beside the point. All right. So we are not even going to go over anything. I'm through a question here. Let's reason this one out. The consequences for performing tasks outside the medical coder or biller's legally approved duties include which of the following? We're talking about consequences. What consequences could you have if you injured a patient without proper training? Could you get fined, fired, prison, pardoned, or a pay raise? Now, I say reason that out because there's two of them that just don't make any sense, right?
A and B and C.
A and B and C, yes. That is absolutely correct. Now, when I talk about reasoning things out when you're taking your test, sometimes you're not going to need to engage for a whole minute in one question. Something like this, you're going to say, oh, that's silly. Of course, pardons and pay raise, I'm not going to get that if that's a consequence. All right, so let's move to the next one. Oh, and I put fines, fired, in prison here. All right, so now we're going to talk about 2 acts. And I just want brownie points, y'all, because I did not use a huge definition of what HIPAA was. I don't know if you guys have ever looked up the definition of HIPAA, but it is long. So I made it short. HIPAA is a law that protects a patient's private health information and makes sure it is safe and kept safe, secure, and shared only with those allowed. So that's HIPAA. What is high tech? Well, look at this, the word tech. Tech's electronic. So high tech is a law that strengthens HIPAA by adding extra protections for electronic health records and increasing penalties for data breaches. So let's just keep those things in mind. HIPAA protects patients' private health information. High tech helps HIPAA in the tech part of that. All right, here we go with the question. If a healthcare employee retrieves information about a patient out of curiosity, that is considered to be which of the following? A, usual and customary office practices. B, break time entertainment. C, HIPAA high-tech invasion of privacy. And D, normal for employees to do.
C.
Now look, if you choose 3 of these, we're going to have a conversation. Hey, Miss Shannon, would you mind putting in chat your answers for me?
I apologize.
Oh, no, you weren't here when I asked that. Don't worry. Don't worry. No worries.
All right, thank you.
So, and Miss Shannon said her answer out loud. So, C, HIPAA high-tech invasion of privacy. All right, so if it's usual and customary office practice, because you know Britney Spears came to the hospital last week and you just wanted to see what was up with her, so you got into her private health information, that is not accepted. And I do want to tell you guys, I want to give you a warning. If you think that nobody could ever find that out, that is absolutely untrue, because in facilities, they do audits. And if you're in someone's account that you have no business being in for a certain length of time, like I could accidentally put Mrs. Hayes, and she's not even in my part of the facility. But I noticed very quickly, within 2 seconds, I pop out of that. I'm not going to be in trouble for that because I saw it was the wrong patient. I didn't poke around in anything. I just got out, right? But if you're in Britney Spears's medical record and you're in there for a certain length of time, you're going to be in trouble. And you may not get caught the first time, the second time, maybe not even the 10th time. But if and when you get caught, it is automatic dismissal. And you're going to be hard pressed to get into another medical facility because you have to put your on your resume your places of employment previously, and they will call and you will be told on. So don't, as much as you want to, don't do it. All right. Now this one is a commonsensical one, I think. Which is a healthcare law that provides subsidies to lower healthcare costs for households with incomes between 100 to 400% of the poverty level. So we're talking about low income, okay? So A, traditional indemnity, I can't say that word, indemnity, Affordable Care Act, conventional indemnity, and flexible spending account. So if you're lower income, you need something that is what?
Affordable?
Affordable. That's absolutely right. So do you see how we can reason some of these things out? Lower health costs, lower income needs to be affordable. Okay, this just looks big, okay? I don't know why I made it this big, but we're just going to go with it. Okay, so which is the best choice if a medical coder and biller witnesses a coworker reviewing their friend's EHR to discover what condition they have, even though the coder biller is not assigned that task or has anything to code in that chart? What should we do if we see a coworker do that? notify the manager, supervisor, and the privacy officer. Ignore the situation to avoid becoming involved legally. Cover for the coworker by stating that it didn't happen. Or D, confront the person and place them under citizen's arrest. I mean, come on. It's a silly thing, huh? We've got to notify the manager, supervisor, and the privacy officer. So I want to know, you see, guys, at the very top, there's a little hand that says raise hand. I want to know who would turn your fellow coworker in the first time, or if you would speak to them and remind them and turn them in if you find out again. So, Angelique, you would turn them in on the first time? What about you other ladies? Olivia would turn them in on the first time? All right, so we're going to put Miss Brandy on the spot. Miss Brandy, what do you think?
Me personally, and this is just me, I probably would have the conversation first, but I'm in a supervisory position, so I would feel like it's my place to do that. But I could understand how, if you're newer and you're recognizing that, people that you don't know that well or doing things that you were taught not to do, it might be best to speak to a supervisor first before confronting anybody. And especially if it's, somebody way outside you don't know their job position, you don't know what their job responsibilities are. They may have accesses granted to them that you are not aware of. So these are all things you want to take into consideration.
Well, I wanted to ask Miss Brandy to give you a bigger perspective for testing purposes. You're going to notify the manager, but in a real world office setting, say that you've been in a place for 3 years and this is a brand new person that probably doesn't even realize she's doing something wrong. It's okay to say, hey, Miss Brandy, I've noticed that you're in something that you shouldn't be in, and I just want to help you not be in trouble. But again, that would take the expertise and the respect level of where you are in your career. So,
But
I don't think
testing purposes, you go to the manager.
that you're going straight to the manager and that's the end of
Per
it.
the book, you go to the manager.
So did all of that make sense?
It did.
Yes, ma'am.
Yes, it is.
Raised.
Yes.
Oh, all right. You guys can click the hand again to unraise your hands. All right, we have another question. And look, we're going to need to select 3. In a medical facility, which employees must comply with HIPAA and high-tech guidelines? Okay, we really need to think about this. Boy, Angelique is already on it. We need 3. So A, doctors and nurses need to protect HIPAA. I'm not saying that. I'm saying, do they? B, landscape maintenance. C, medical coders and billers. D, housekeeping staff. And E, visiting salespeople. So I've got an A, C. Shannon, do you agree with A, C, and D?
Yes.
Okay, did you have a question?
No,
No,
I'm
no.
sorry.
No, you're good. You're right. A, C, and D. Doctors and nurses, because they're viewing the medical records. Medical billers and coders, they're going to be able to get into medical records. Housekeeping staff, they're emptying the trash, they're dusting, they're vacuuming. Miss Brandy and I used to work at a medical billing and coding facility together. And we had the most amazing young lady that used to come and to do our stuff. She had to sign a HIPAA agreement that she was not going to share any information that she could possibly have seen. So, so you're absolutely right. Landscape maintenance, they don't come in the building. And visiting salespeople should never be in a spot where they could actually see protected health information. Okay, so we're going to select 3 again. And look, we're going to reason them out. Ethical principles for medical clinics and hospitals include which of the following? So we're talking about ethical principles. Telling untruths about the patients. Avoiding conflicts of interest. Accountability and responsibility. Behaving unscrupulously. And protecting PHI. All right, so let's start picking them apart. So if you're telling untruths about patients, are you ethical? Are you being ethical within the workplace? Absolutely not. So if you're avoiding conflicts of interest, so would conflicts of interest, avoiding the conflicts be ethical? It absolutely is ethical. If you take accountability and responsibility, is that ethical? It absolutely is ethical. So we got B and C. D, behaving unscrupulously, which means behaving inappropriately. Is that ethical? No. Protecting PHI, is directing personal health information ethical? Yes, it is. So it's going to be B, C, and E. Do you guys understand why those would be the answers? I bet you some of you guys read through it really quickly and misread. So avoiding conflicts of interest, accountability and responsibility, and protecting PHI. I do want to tell you guys, just as a precautionary thing, when you're taking your test, make sure that you read once and then you read once and then you read again to make sure that you're not misreading something. Believe me.
Question 3 times to make sure I answered it correctly. That's why my answers are out of order. CBE.
CBE. Great. Yeah, good job, Angelique. All right. So this is something I want you guys to pay very close attention to. Because when we think of abuse versus fraud, we think abuse is like, put them up, pop you a good one. Being abusive to whoever. You're hitting them, you're berating them, maybe cursing at them. Okay. That is not the type of abuse we're talking about here. We're talking about abuse within medical billing and coding. So abuse is the unintentional or improper use of something. The very important word that you need to remember here is unintentional. Abuse within this realm, is unintentional. Fraud is intentional. So abuse is unintentional. Fraud is intentional. Like when you're writing out a check that you stole from your neighbor, that's intentional fraud. And look, when y'all think about this later, when you're at your taking your test, you're going to say, I remember Miss Marcia stealing her neighbor's check and writing on it. And that is fraud. And she did that on purpose. So it's intentional. Silly little things like that work for me. All right. Which is an example of healthcare fraud? What is fraud? Is it intentional or unintentional? It's intentional. So using paper claim forms, Upcoding or misrepresenting non-covered services. Claim form osteopaths. Submitting claims supported by documentation. So upcoding or misrepresenting non-covered services is fraud. In order to upcode, you have to decide what a code is and decide that you're going to make it a bigger code so you get more money. That's what upcoding is. It's also if a patient comes into a cardiology appointment and they only see the cardiologist, but you decide to tack on an EKG onto that, even though you didn't do it, that's misrepresenting and upcoding. Okay, so I want you to really take note of this. Don't look at this over here yet. Let's talk about the anti-kickback law. It's a federal law that makes it a criminal offense to knowingly or willingly offer, pay, solicit, or receive any remuneration to induce or reward referrals of items or services reimbursable by a federal health care plan. Okay, I know that's a mouthful. Just stick with me. Okay, so I'm going to give you a scenario about the anti-kickback law. So my husband's going to go see his doctor. He goes to the doctor. He finds out he has to have all these procedures done. And he says, my husband says, okay, doc, I tell you what, I have season tickets to the Saints games all season long. I'll give these to you if you don't charge me for my procedures. That is a breach of the anti-kickback law. Okay, the Stark Act is an amendment to the Social Security Act that prohibits physicians from self-referral when sending patients elsewhere for certain services. You guys may want to double check that. So I said wait till we got to the end. Let's talk about what the Stark Act is. I'm going to give you a real world example. I am a general practitioner, and Miss Brandy is a cardiologist. She's my cousin's sister. Every patient that comes through my facility, I send straight to her. Every patient that she has coming in, she sends to me. It's like a self-referral slap. Also, I pay her light bill every month, and she pays my water bill. So we are financially beholden to each other. All right, self-referral. Which of the following is an amendment to the Social Security Act that prohibits physicians from self-referral when sending patients elsewhere for certain services? The Stark Act, the Anti-Kickback Law, Truth in Lending, and False Claims Act. Yeah, I got y'all good on that one, didn't I? I purposefully put them out of order. We have to make sure that we always read and take into account. So remember, anti-kickback law, they're giving you something instead of actual insurance and what they owe you. Instead, they're giving you an object. They're giving you, oh, I'll pay for your kids' tuition to go to the Catholic school down the road, you know. And Stark law is about self-referral. Okay, here we go. Are we ready? What does the federal anti-kickback statute prohibit? the use of written agreements in business relationships between healthcare providers, the provision of Medicare and Medicaid services without prior approval, the offer or solicitation of remuneration in exchange for referrals of federally payable services. Okay, y'all, just hang on. The establishment of partnerships between healthcare organization and for-profit sharing. Okay, so who gave me C? Angelique?
Yes.
Quenisha, did you guess A?
I didn't put my answer yet.
Oh, okay. I can't. That's the thing. I can't tell which answers go with what question.
I think that was for the last question.
Yeah. Okay. So the answer is going to be C. Okay. Do you see offer?
Yes.
Offering him something in exchange for payable services. Solicitation, remuneration, all of those things go with the anti-kickback law or statute, whatever. Congratulations. We are done. How do you guys feel? Take yourself off of mute and talk to me. Let's communicate. Did you feel like that little study session helped you in any way?
Yes.
It did. Some of it was kind
Yes,
of
it did.
Okay. So when it comes to taking the NCCT Stark Law, or I'm sorry, Stark Law, Laws and Ethics portion of the NCCT, these are sample questions of what's going to be on there. So make sure that you're making sure what the Stark Law is, the anti-kickback law. I know those are very confusing. I would say do your own research on those and make sure that you know that you know that you know. But like the Affordable Care Act, that's easy to remember. You have to be, it's for low income or people who can't afford the services. So there are ones that make a lot of sense and some that you got to dig into a little bit. Also, I'm not going to tell you, but something else that I want to challenge you to do. I want you to find out what the birthday rule is in medical insurance. And then I want you to impress your instructor by telling her what it is. It's not, I'm not telling you have to. It's just a challenge. You don't have to meet the challenge. But, you know, I think instructors would be pretty impressive for you to say, hey, I know what the birthday rule is. I found out what it was myself. So any questions for me?
No.
Well, I love. Oh, thank you, Olivia. I love spending time with you guys. Thank you for coming. Thank you for participating. I really, really appreciate it.
Thank you for
Thank you.
putting together that presentation for us, Miss Marcia.
You are so welcome. I was a little out of practice, Miss Brandy, but I did the best I could.
You did great. You did great.
Thank you.
It's been quite a while since I was able to do this, and I had a wonderful time. I hope that you guys have a wonderful afternoon. And Angelique, I have you on my to-do list for what we talked about earlier.
Thank you.
You bet. You guys have a great day.
Yes,
You
ma'am, you
as
too.
Bye-bye.
Bye-bye.
Thank you.
Bye.